Hi everyone and welcome. I'm Dr. Atkins with the Cosmetic Enhancement Center of New England, and we are so excited to have you here for Reclaim Your Confidence Vaginal Rejuvenation with CEC. Tonight we're talking about real modern solutions for bladder leaks, urgency, dryness, and decreased sensation and overall confidence, including EmpowerRF, Emsella, and the O-Shot. As a thank you for attending, you qualify for an exclusive event-only promotion. Buy 2 treatments and get 1 free. And you can mix and match EmpowerRF, Emsella, and the O-Shot. This special is valid through June 26, 2026. We also have amazing giveaways tonight. One person will win a series of 6 Emsella treatments valued at $1,500. 2 people will win a CO2 Lift V-Care mask 3-count kit valued at $365 each. Stay tuned until the end for a live question and answers. Let's talk about the symptoms so many women experience but rarely talk about. Bladder leaks when you laugh, sneeze, or work out. Sudden urgency that feels impossible to control. Dryness or decreased sensation during intimacy, or just not feeling as confident in your body as you once did. These changes are incredibly common, but they're not something you have to just accept. So why does this happen? Hormonal shifts, especially after childbirth and perimenopause and menopause, affects tissue health and moisture. Pelvic floor muscles weaken over time. Pregnancy, delivery, aging, and even high impact exercise can strain the muscles that support your bladder and sexual function. Blood flow decreases, affecting sensitivity and lubrication, and the skin and tissue lose elasticity both internally and externally. This isn't about aging wrong, it's about your body needing support in the right places. At CEC, we offer EmpowerRF, a modern non-surgical solution designed to restore both function and confidence. It combines radiofrequency and electrical muscle stimulation to treat the full picture, from pelvic floor strength to lubrication, sensitivity, and external rejuvenation. It's non-invasive, customizable, and designed for real lasting results. V-Tone EMS pelvic floor strengthening. V-Tone uses electrical muscle stimulation to strengthen weak pelvic floor muscles, the same muscles that support your bladder and sexual function. It helps reduce stress and urge incontinence, improves control, and gives you more stability and confidence in your daily life. Think of this as rebuilding your body's natural support system from the inside out. FormaV and Morpheus 8V, RF tightening and rejuvenation. Radiofrequency treatments like FormaV and Morpheus 8V increase blood flow, improve tissue health, and enhance lubrication and sensitivity, and stimulate collagen for tightening and rejuvenation. This supports both comfort and confidence, internally and externally. It's about feeling good in your body again and seeing that confidence reflects back at you. Emsella uses high-intensity, focused electromagnetic energy to stimulate deep pelvic floor muscles that are difficult to activate on your own. It's designed to help with urinary incontinence, urgency, frequency, bathroom trips, postpartum pelvic floor weakness, age-related muscle decline, and even reduced sexual sensation. It's completely non-invasive, fully clothed, and incredibly effective. The O-Shot uses platelet-rich plasma, or PRP, derived from your own blood. PRP is rich in growth factors and stimulates healing and tissue regeneration. It's carefully injected to improve blood flow, sensitivity, and tissue health, helping with low libido, difficulty achieving orgasm, and vaginal dryness, pain during intimacy, and even mild urinary incontinence. It is a natural regenerative option that pairs beautifully with EmpowerRF and Emsella. When you combine these technologies, EmpowerRF, the O-Shot, and Emsella, you get a truly comprehensive approach to restoring wellness. Imagine moving through your day without worrying about leaks or urgency. Feel comfortable, confident, and connected again. Enjoy both the physical and the emotional benefits of restored function. This is your moment to take back control, restore your confidence, and feel like yourself again. Just stronger, more supported, and fully empowered.
I feel like almost like a vibration, and then I can feel my pelvic floor contract with the vibration. It's not painful. It's just different.
Thank you all so much for joining us tonight. As a reminder, because you attended this event, you qualify for our exclusive promotion. Buy 2 treatments and get 1 free. Mix and match any of the treatments we discussed tonight. This offer is valid through June 26, 2026. Our giveaways include a series of 6 Emsella treatments, a $1,500 value, and 2 CO2 Lift V-Care masks, a 3-count kit valued at $365 each. Winners will be notified by email or phone, and most importantly, check your texts after the event. You'll receive a message from us. Just reply back to book your consultation or appointment, and our team will reach out to schedule. I'll be here for the next 20 minutes or so answering your questions live, so feel free to drop them in the chat. Thank you. Hi, everybody. Welcome. Thank you for coming tonight. I really appreciate everybody taking out some time today to chat with us. I hope you learned a little bit from our video. We are going to be answering questions now, and we'll kind of go back and forth. I want to introduce Natalie. Natalie Nichols is our women's wellness specialist, basically, and she is a NP who has done most of our Empower treatments now, and she has a lot of good knowledge and background in women's health. So we'll get started with some of the questions, but I also want to remind everyone what the specials are. We will have not only a giveaway tonight for a series of 6 Emsella treatments. One winner will receive that. We will also have a pack of a 3-count CO2 Lift V, which is an at-home vaginal treatment that you can do. And if anyone knows the CO2 Lift mask that we have in the office for your face, is very hydrating, feels amazing afterwards. They have one for the vaginal area as well. Also very hydrating and can help to lubricate the area. So you'll be able to win that as well. That is available in the office to purchase as well. So reminder that all of the questions we see
Nobody else sees your questions. Nobody else can actually see that you're even on here and can see your names. So do not feel shy. Just go ahead and throw out your questions if you have them, and we'll get started. We'll try to go bounce back and forth, but I feel like I'll probably answer more of the questions and the Emsella questions. I've done more of those than Natalie, and Natalie has done more Empower questions, so she will likely answer a lot of those questions. So let's start with the first question. First question is, how long does each session last? So I'll start with the Emsella. Each session, and we do recommend a series of 6. You can do more, but we do recommend a series of 6 to get lasting results. Each session is about 28 minutes, and it's very comfortable, and you come in fully clothed. You put your things aside, sit and read a book if you want to, or just relax for a bit, and then you're out of the office. And a series of 6 can be done once a week. You can do it a little quicker than that if you need to. And I typically tell people, something like that is a muscle building product. You're building the muscle in this and support in your pelvic floor, and you're probably going to want to do a touch-up maybe once every 3 or 4 months, because when you build muscle just like you do at the gym, it goes way over time, and unless you're continuing to work it out, the muscle, you're really not going to maintain it. So maintaining it with one session maybe every 3 or 4 months would be very helpful. When it comes to the O shot, it's quick. I mean, the session itself probably scheduled for about 40 to 45 minutes, but literally it takes me 15 minutes, 10 minutes, 15 minutes to get the O shot done. You'll come in early to get your blood drawn and to spin it down and to get prepared and undressed and ready. But most of your time is prep, and then getting ready afterward. After you're done, you're not going to have a lot of time in the actual procedure. It takes very little time to do the injections. You want to go ahead, Natalie, and talk about the timing for each of the Empower devices?
Yeah, so EmpowerRF encompasses the V-tone for pelvic floor strengthening and rehabilitation. FormaV is the delivering controlled heat, so the radio frequency. And then Morpheus 8B is delivering microneedling and radio frequency. I know it can get a little confusing between all the names, so I just wanted to refresh everyone. So how long does each session last? So V-tone is a series of about 6 to 8 treatments spaced 1 week apart, ideally. And generally, we recommend 1 maintenance treatment. It can range anywhere from 6 to 12 months. That all depends on your symptoms. And like Dr. Atkins was saying, the pelvic floor is a muscle. So just like any other muscle in our body, if we don't exercise it, it will get weaker. So V-tone lasts about 30 minutes. So the first 3 to 5 minutes, I really try to find your sweet spot. And the goal is for you to feel a strong pelvic floor contraction, but it shouldn't be painful and it should be tolerable. And I always check in with you, making sure that you're feeling okay and it's not painful. But we start at level 5 and gradually increase you to whatever level that feels, like I said, like a strong muscle contraction, but tolerable and not painful. And then for about like 20 to 25 minutes, we keep you in that range that feels good for you. And that's not to say, with 5 minutes left in the treatment or mid-treatment, you're like, oh, I kind of want to see what the next level up feels like. We can certainly adjust that at any time. But yeah, it's 30 minutes. It's there's no numbing involved, and women do really well with it. FormaV, so this is the one that delivers radio frequency, so heat to the tissues. So this is a series of 3 treatments spaced 4 to 6 weeks apart, and about 1 year maintenance treatment. FormaV intravaginally is 15 minutes. Externally, which I'll mention this, so with Morpheus 8B and FormaV, you have the option to treat externally. And this can help with tightening and improve appearance, texture, firmness. with Morpheus 8 providing more advanced remodeling, given that it's microneedling and radiofrequency. But that's an option. It's included in the price. So some women just choose not to do it, but it is included in that overall price. And so anyways, with FormaV for external treatment, it actually takes a little bit longer. It takes the tissue a little bit longer to heat up. But once it's heated up, it takes about, and you can have the mons treated, you can have the labia majora, the labia minora, and the clitoral hood treated. So it takes about, for the mons, I try to do like 10 minutes for a good treatment, labia majora 10 minutes, and then labia minora and clitoral hood about 5 minutes because it's a little bit more of delicate tissue. But yeah, and with FormaV, there's no numbing. And just externally, just because the tissues can be a little bit more sensitive to the heat externally. But so FormaV, all in all, if you do intravaginal and external, probably takes about 40 minutes by the time we heat up all the tissue externally too. Morpheus 8V, so that's our microneedling with radiofrequency. That is a series of 3 treatments spaced 4 to 6 weeks apart, once a year maintenance to keep up with that, collagen remodeling. So that's that treatment takes about, depending on your treatment plan, and we really tailor your treatment plan based on your individual symptoms and needs. But it probably takes Morpheus 8V about anywhere from 15 to 25 minutes. And then externally is actually pretty quick. It's about, because I usually just do one pass over each area, and that takes about maybe 3 to 5 minutes, honestly. So women do really well with it. Surprisingly, I know microneedling intravaginally sounds scary, but I do numbing intravaginally 20 minutes before I start. And right after I apply the numbing, the BLT cream, which is the numbing cream, right after I apply intravaginally, I apply externally. And while I treat intravaginally, I leave on the external BLT cream, numbing cream, to give that more time to numb. And then once I'm done, I wipe off the numbing cream, obviously clean, and then treat. So yeah, and all 3 treatments can be done at once if that's what you are wanting done based on, the consult that we have. But just know that all 3 can be done in the same treatment session. So, all right. Sorry.
Great. I appreciate that. While you were talking, I realized I went through the giveaways, but I never told you what the actual special is before the end of June, by June 26th, I think it was, right, Natalie?
Yeah.
That since you've attended today, you will be able to buy 2, get 1 free for a mix and match of any of these, whether it's Emsella or V-Tone or FormaV or Morpheus 8V or the O-Shot. You can mix and match each of those. I always tell people that, it's just like with facial aging and treatments for the face. When people come in for their initial consultation, I always tell them, the people who are the happiest with this stuff are the people who try to do a little bit of this and a little bit of that, and not necessarily try to throw all their eggs in one basket and just do just Botox, say. The people who try to do a little bit of, care for the skin and the tissue as well as the muscle, you're going to do better than if you just try to do one thing. So the mix and match is ideal for that situation. The next question looks like how soon will we see the results? I think with the O-Shot, people notice that improvement almost immediately, and then it kind of lags a little bit after about 10 days, and then it starts to stimulate the collagen, and then around 6 weeks is when you start to see that again. And with the O-Shot, we do a half price O-Shot if you do it within 3 months of the first one, so that that treatment again, if you want a little bit more improvement with that. With the Emsella, I think it really takes the series of the 6 treatments before you're really seeing some results. Have I had some people see results faster than that? Yes, I do find there are handfuls of people who say they swear that it's better after 1 treatment, but I really think that most people need that full series of 6 treatments, because it really is building up the muscle tissue. Just like the V-tone, you're gonna probably need the full 6 before you see a significant improvement. Although the V-tone is internal and you're getting more directed muscle contraction from the inside with the V-tone, so it might be a little faster with that. What are your thoughts, Natalie?
Yeah, I think with the V-tone, many patients are seeing after 2 to 3 treatments improved bladder control, symptoms of urinary incontinence of all types, and even increased tightness. So obviously it depends based on the patient, but really optimal results are seen 1 to 2 weeks after your final treatment. So after the final series, or full series, I should say.
And the FormaV and Morpheus 8, what do you think with that?
Yeah, so FormaV and Morpheus 8V, we're delivering heat to the tissue. So there's collagen contraction happening right away. So patients may find some tightening initially, and because we're increasing blood flow to the area, also improvement in vaginal dryness, so improving that vaginal lubrication. So that can be common to see kind of right off, but optimal results for both Morpheus 8V and FormaV are seen 6 months after the final treatment, after the full series. So, it does take some patience, but it's definitely worth it, giving that collagen time to remodel and elasticity to build. It really will help with the quality of the tissues and support. So,
yeah. Okay, so the next question is the downtime. So the downtime with the Emsella is nothing, basically. You don't even go about your own business like immediately. You're not really have any downtime. You won't even feel sore. It literally is amazing that you don't feel sore with the amount of contractions that happen. Then with the O-Shot, definitely the O-Shot creator, Dr. Charles Reynolds, is who I trained with initially when I started doing the O-Shot, and his philosophy is, you use it or lose it. So he's like, go for it right away. We're more than happy to have you go ahead and go about your own activities, sexual activity included, is fine immediately after. A lot of people don't feel like it that first day, only because there's the numbing cream that we use, and they just had a few injections, but they really don't feel bad, and there's no downtime afterwards. You might have a little spotting, and that's about it for a day. Sometimes you'll feel a little gush of fluid, but other than that, there's really nothing with the O-Shot either. No pain or anything like that. The others?
Yeah, so V-tone, so that's the pelvic floor strengthening intravaginally. That really no downtime. I do say though, if patients feel a little bit of pelvic floor soreness the next day, just to avoid intercourse for about 24 hours. But I always tell patients to listen to their body, but really minimal to no downtime with V-tone. And then FormaV and Morpheus 8V, you can have some spotting and discharge for a couple of days. And we just say no sex, nothing intravaginally for 2 days, so pelvic rest. And then just no submerging yourself in like a hot tub or a bath or going swimming in like a public place or a pool, stuff like that, for 2 days. So really not too bad. I mean, really just 2 days of minimal adjustments. So
Great.
Yeah.
I also want to remind everyone that you will be receiving a text, and please reply with the code word EMPOWER if you want to be contacted for a consultation after this. And the next question is about the artificial hips. Somebody wants to know if some of these treatments can be done if you have any hip replacements. So with Emsella, the muscle contraction, it is not an issue. If you have new hips and have discomfort with the treatment because of new hips, then you'll know immediately, and we can just stop and push it off a couple of months. But it's really contracting the muscles. There's no heating of the area, so there's really no worry with artificial hips. With the O shot, there's no issue whatsoever. The only issue would be your comfort level getting into the position, because we do get you up into stirrups with any of these procedures except for the Emsella. And correct me if I'm wrong, but even the radio frequency with Empower is not going deep enough to actually heat up the metal in the hip. So it shouldn't be an issue with that either. Am I right?
Yeah.
Yeah. Yeah. So really artificial hips are fine. It's just more of a recovery from surgery to make sure that you're going to be comfortable during the procedure, being up in stirrups and tolerating the treatment. But if you're, uncomfortable, like I said, we can always postpone it a little bit. But most people should be just fine 6 to 8 weeks after a surgery. And that's pretty much all the questions I'm seeing. Do you think of any other questions that you want to answer or things that you thought of?
I do see one question here. Does insurance typically cover any of these treatment modalities? As of right now, no. And Dr. Atkins, do you want to kind of talk a little bit about that?
Yeah, I can talk about that. Basically, the insurances do not cover these kinds of procedures, even if you have a documented medical issue, because they consider it experimental, but they also consider other things experimental that have been well accepted in medicine for years. So it's basically also an issue that we are primarily a cosmetic practice, and because of that, we don't take insurance. And so unless we were a provider that took insurance, then you couldn't even apply for insurance and fight it, unfortunately, because we're not a participating provider for insurance plans. However, if you have a kind of insurance that, or a plan with your employer that is health savings account, something like that, that you put money into or your employer puts money into, generally those can be used because these are medical problems, and all those require is a note from the doctor or a receipt showing that it was for a medical issue. So health savings plans, FSAs, things like that should be fine. It looks like I just didn't scroll. There's more questions now. What if I have a prolapse? Can I still get the O shot? Yes. So the prolapse is challenging if it's a full prolapse. If the entire bladder uterus is coming out with a prolapse, then it is very challenging to do an O shot. If it's just a partial prolapse, then yes, I've done it before and it can be done. It's not going to retract all of that. You may want to consider using some muscle contraction to support the prolapse a little bit, like the Emsella and or the V-tone to start, and maybe even getting some tightening. But definitely the O shot is still an option.
Yeah, and along those same lines, I see if I have a prolapse drop bladder, what is best? So I would say definitely V-tone to help with that pelvic floor, helping to strengthen and rehab that and give a little bit of a lift to support that bladder or urinary system. And then also the Morpheus 8V, and that's with the microneedling and radio frequency, because that's going to help provide deeper collagen remodeling in the vaginal tissue, which can in turn help to give a little more tissue support and improve its tissue quality to help give more support overall in the vaginal wall. Do you have anything to add to that, Dr. Atkins? Or
there was a question about just doing the O shot. I think she said O factor, but I think she meant the O shot. And yes, you absolutely do just the O shot for people all the time. It's, you want to start there and see if that's enough for you. A lot of people have been very happy in the past with just that. The next question was about how long things last and how often do they need to be repeated. Most of these are going to be once a year. You're going to need to keep up. You don't stop aging. You don't stop losing collagen. It's just like for the face, you're kind of, trying to keep up with that aging process. So at least once a year, a touch-up treatment, not necessarily a series, again, not necessarily a full series of Morpheus 8 treatments or a full series of FormaVs, but you might want to do one of each. With regard to the muscle tightening, the muscle contraction, either the Emsella externally or the V-tone internally, those are more repetitive because you're building muscle and muscle weakens over time. So you'll do a series, maybe one treatment every 3 to 4 months for the Emsella. And then what do they recommend for the
V-tone?
Sorry, V-tone?
Yeah, so it's a series of 6 to 8 treatments, 1 week apart, and maintenance is 6 to 12 months, anywhere in that time frame, depending on your symptoms and how much that pelvic floor weakens.
Right. Okay, and urinary issues. So there's a question here regarding what we would recommend for urinary issues. I would always recommend a free consult with Natalie. You can do it virtually if you'd like, but in person is fine. Our consults are always free, and you can discuss your specific issues. But there's a lot of different types of urinary issues that people have. There's urgency, there's frequency, there's bladder leaking, both stress incontinence and other type of bladder leaks that this can help. And depending on which type of problem you have will determine which is your best modality first. Again, I always say that, a little bit of this and a little bit of that is always going to be better, but where you would start is going to be specific to whatever your urinary issues are. And a good start is always with Natalie and a free consultation.
Urethral sling, does that hinder these treatments?
Yeah, I think that the Emsella and the O-shot would be fine. The V-tone will probably, and you can chime in here too, it will probably depend on how the contraction feels when you have the contraction. If it's pinching at all with the sling in place. And then I probably wouldn't recommend the Morpheus 8V because the needles, we don't want those to penetrate into the sling around the urethra. When it comes to the FormaV, thank you.
Yeah.
I think that's going to be also it may or may not be comfortable for you, so it may not be the right thing. I think starting with some muscle contraction and O-shot might be your better route than the heated devices if you have a urethral sling. Okay, so we have somebody who has a specific issue of some hypertonic pelvic floor causing pain. Is a possibility with maybe FormaV, but I don't think that the muscle contraction devices are going to be helpful if you're overtoned there. Then there's no reason why you couldn't do the O-shot with that, because that's just going to help the tissues improve quality of the tissues. And I feel the same about FormaV, frankly, and the Morpheus 8V. Maybe a little uncomfortable having the treatments at first until we can get the floor to relax. But you can definitely still do those treatments. Whether or not they're going to help with the hypertonic pelvic floor is hard to say. The most likely treatment for that is going to be probably more pelvic floor therapy for relaxation of those muscles. And does the treatment help with prolapse? Okay, so technically, yes, any prolapsing tissue can improve with tightening procedures and the strengthening. However, again, that depends on the amount of prolapse. I've seen prolapse where, your uterus practically prolapses out of surgery is the only thing that's going to help with that. If you just have a little slight bulge, then yeah, I think tightening and improving the tissues and strengthening the muscles can definitely help that. Is it going to take it away completely? Probably not.
Yeah.
And then same with the retroseal. Retroseal is a little bit of a prolapse of the rectum out into external vaginal area. And same thing, that heat can tighten that tissue. They use radio frequency heat to help with hemorrhoids and, prolapsed hemorrhoids. And so, yeah, definitely radio frequency is a long-standing treatment for that area as well, and can be done to improve that. And then always strengthening the muscles is going to help with that too. Do we have any more? Looks like we have come to the end. Unless anybody types any more questions, I think we're good. But if you do have any more that you didn't think of, please send them anyways, because we will look through all these questions again at the end and make sure that we did answer them all, and we'll get back to you personally if we didn't answer any of your questions. And feel free to schedule a free consultation with Natalie, because she will definitely be able to answer more specific questions for your personal problems or issues. And reminder of the specials. We got 3 giveaways. 2 of the CO2 lift masks will be given away, or 2 packages of 3 will be given away. And we also will have until the end of June, around the 26th of June, we have the buy 2 get 1 free treatments. And we didn't go over pricing, actually. Let's do that. Why don't we do that? Do you want to go start with the pricing?
Yeah. So FormaV is $900 a treatment. And like I said, it's a series of 3 and about once a year maintenance. Morpheus 8V is $1,000 a treatment, series of 3, once a year maintenance. And V-Tone is $300 a treatment, series of 6 to 8 treatments, 1 week apart, about a maintenance every 6 to 12 months. And one other thing I wanted to mention too, outside of this giveaway, if you do purchase 3 treatments up front, you do get 10% off. And if you purchase 6 treatments, say 6 V-Tone treatments, 6 Emsella treatments, you get 20% off if you purchase them up front and pay for them up front.
Right. Great. And the treatments are $300 a treatment. A series of 6 treatments is $1,500. And then the O-shot is $1,100 for a treatment. And if you do a second one within 3 months, you get half price.
And there's a question about, does the buy 2 get 1 free apply to those already doing treatments?
If you're doing treatments already, it kind of depends on your certain situation and what your pricing was at the time and how many you've already done. But we can talk about that specifically with you. So just contact Natalie and she can help you through that. And this is supposed to be only of the buy 2 get 1 free for the people who've attended the event today. So nobody else will be able to partake in that. It's just those of you who have come today will be able to partake. And yeah, that's it. Thank you for coming. I really appreciate it. I always am very excited to talk to people about our procedures and be a little more in depth than we can with our social media and all of that. So I appreciate it and thank you so much.
Yes, and same. And like Dr. Atkins said, you can always just book a consult. It's free and we can talk about it. We can take our time and, you could do it through telehealth, come into the office. So it's really flexible. But yeah, free consult. So don't be afraid to reach out.
Great. Thank you. Bye-bye.
Bye.